Joining us on the show today is Dr. William Sawyer. Dr. Sawyer is a physician from Cincinnati, Ohio. He holds a degree from the University of Cincinnati College of Medicine and has been interviewed on radio and television around the country and in the Philadelphia Inquirer and the New York Times. He's also the founder of the Henry the Hand Foundation. Dr. Sawyer, thank you for joining us today.
Right. Happy to be here. Thank you.
Thank you. We discovered that the National Handwashing Awareness Campaign, which runs through December 6th through the 12th, you describe your focus on primary infection prevention. How does the Handwashing Awareness Campaign help prevent primary infections?
So the Hand Washing Awareness Campaign promotes knowing where your hands are and what they're doing at all times, i.e. there are 4 principles of hand awareness associated. So if we start washing our hands regularly and before we eat when they're dirty, which is the first principle, and then there's the second and third, which is if you're going to cough or sneeze, don't cough in your hands, throw an elbow or a tissue. And the fourth is, above all, do not put your finger into your eyes, nose, and mouth, which is how you give yourself the flu, COVID-19, and many other viruses you just don't want. So it helps raise awareness on an annual basis, which should be every day, frankly.
Of course. In another interview, you mentioned the results of a study you conducted about people's unconscious behaviors, how they touch their eyes, nose, and mouth without even realizing it. How prevalent is that behavior, and is that an opening to infection?
Correct. So the unconscious habit of putting your finger in your eyes, nose, and mouth is how we give ourselves these viral respiratory infections. And so the study we did in physicians' offices are the physicians and nurses who believe they did not have that bad hygiene behavior or bad hand hygiene behavior did in fact equal to those who admitted to it. So we had to come up with a way to help change that unconscious behavior to help protect them.
You also described the T-zone of the face. What makes it especially vulnerable to transmitting infection?
Right. The T-zone, which you can see when you make a image of a T, it's for your eyes, nose, and mouth, which are the only portal of entry into the respiratory system. And that's why it's a good visual cue for many to remember, and as opposed to saying, don't put your finger in your facial mucous membranes of the eyes, nose, and mouth. That's a handful, or a mouthful, I should say.
Earlier, you told us about the 4 principles of hand awareness. What methods have you found to effectively promote correct hand washing?
Well, one of the cues or triggers are, we use Henry the Hand, the champion hand washer, who is a character, a cartoon character, which is very helpful. And many people will respond to cartoon characters, i.e. Disney would tell you that. And then what we also have other items that we can use in techniques, i.e. Glo Germ. You put lotion on your hands, turn a black light on, and suddenly, whoa, you have fluorescent germs on there. We have an atomizer that teaches when you cough or sneeze, droplets come out and you need to cover your cough and surfaces are contaminated. And the ultimate one is where we ask you to wear a shield as a training device, which is what we have in the classroom toolkits for the past 15 years. It's hard to put your finger in your eyes, nose, and mouth, and it makes you aware acutely so that you don't self-inoculate many different organisms, i.e. COVID-19 now, particularly.
Yeah, that's a bigger one now. So preventing the spread of infectious diseases, is this why you founded the Henry the Hand Foundation in 1999?
Correct. So what I had learned frankly, as a physician, I've seen patients have this bad hand hygiene behavior, and they were getting sick. And I had children in daycare, and I thought, I don't want them to be sick. So we started this hand washing routine back in the early 90s. And they were healthier than the kids who went or stayed home from daycare, frankly. And then we instituted a program at the school in the late 90s, built a costume, a curriculum, and the kids loved Henry the Hand. It was a great resource. And then in 1999, there was the first flu vaccine shortage going on, and we did a program of hand washing and coloring contests in schools, and the health commissioner was washing his hands on TV with Henry cheering him on. And it was a very successful year, frankly. Hardly any schools in the region closed. And I thought, wow, this is for the world. This will be a pandemic prevention. Unfortunately, we have a small foundation, and I thought, gosh, there should be funding to teach this because this is a public health issue, number one. Still trying, and I still want you all to get the word out because it's critical now more than ever.
Yeah, hand washing has been promoted more now in schools and in workplaces, even at home,
Right.
more now
Yeah.
than it was before, even though it's important to wash your hands at all times.
Correct.
So,
Yes.
how often do you think we should wash our hands? And do you think sanitizer is an effective alternative?
So the short answer is frequently. And historically, what you want to do is if you can wash your hands, today, for sure, every hour and a half, unless you're in an environment that's contaminated, frankly. 2 hours, possibly if you're at home safely, but you just don't know what's on those surfaces. We don't have any special glasses. And unfortunately, when somebody comes home sick or goes into the office sick or the classroom sick, 90% of the commonly touched surfaces will be contaminated within the 24 hours. So you don't know whether it's contaminated or not. So it's guesswork. So if you have a habit of touching your eyes, nose, and mouth, if you were washing your hands routinely, frequently, every hour and a half, for instance, you're less likely to give yourself a large viral load. Now, hand washing is the gold standard. There's not a sink always within reach, but sanitizers become an option when the sink is too far away. Then you have to use them correctly, and it has to be alcohol-based sanitizer, at least 60 to 70%. And you have to use enough of it, cover all the surfaces, and let it dry. And some people just are on such a fast pace, they don't quite do that. But hand wipes, baby wipes work as well to remove it if you do it effectively and remove it from all surfaces.
Even after using hand sanitizer, we should still be able to go wash our hands at some point.
Well, if you can't, yes, at some point, certainly during the day, because organic matter can get on your hands, and you just, if they're dirty at all, you have to do soap and water. If they look clean and you've been in an office setting and they look clean, sanitizer can work, but it's hard to. And in schools, it's very difficult because the surfaces are contaminated and it's just, you have to be hand aware. Again, back to the whole hand awareness. Where are they and what they're doing? So if you don't inoculate your mucous membranes of the eyes, nose, and mouth, you're less likely to give yourself something.
Yeah. Do you mind repeating the 4 principles of hand awareness?
No, sure, happy to do it. So the first one is wash your hands when they're dirty and before eating. Number 2 is do not cough into your hands. Number 3 is do not sneeze into your hands. And number 4 is, above all, do not put your fingers into your eyes, nose, or mouth. So, and these were endorsed by the American Medical Association and the American Academy of Family Physicians in 2001. And I just wish we had promoted them ever since, and they had, and vigorously, and we had taught these in every school in the country, maybe the world, and we wouldn't be in this mess today. So we're counting on all of you to get out and spread the word, not the germs. And also, I don't know if we're getting into this, but I want everybody to wear eye cover and nose and mouth. So a full face shield covers eyes, nose, and mouth, protecting me from others right around me and my 10 most deadly weapons. And so when we wear a nose and mouth mask, our eyes are exposed, so we say, put goggles on or safety glasses or a shield over the top. And then this will end in 12 weeks if we're all doing it. Eye cover, never mouth cover. But it's hard to get that message out today.
Yeah. Well, Dr. Will Sawyer, thank you for joining us. It has been a pleasure. You can find more information about Dr. Sawyer's campaign at henrythehand.com. Thank
Right.
you.
Thank you very much. I'm counting on you, Erica.